Hi, welcome to Socialpost Health channel viewers. I am Dr. Chava Anjaneyulu, Senior ENT Surgeon working with Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having the laser treatment facility. Laser treatment helps fast recovery after surgery and very less pain, and during surgery also blood loss is very less. So most of the times with these advantages we are using lasers whenever possible to do oral surgeries, nasal surgeries and laryngeal surgeries. Some patients will have the history of the bunches of grapes in the nose. And in the nose we see small grapes like materials, white grapes. These are multiple. This is basically nasal polyp problem. If there are multiple nasal polyps in the nose, it looks like a bunches of the grapes. These bunches of grapes, nasal polyps, mainly caused by the nasal allergy. If any patient have nasal allergy, especially to dust, if they neglect, if they don't get treatment, this allergy will turn into the polyp problems. Sometimes rarely it may occur due to congenital problems like cystic fibrosis. But the commonest reason for these bunches of grapes or nasal polyps is due to allergy. That also house dust allergy mainly. Whenever patient has bunches of grapes in the nose, we have to evaluate mainly by the CT scan and allergic skin prick test. CT scan of the sinus will help to know the extent of the disease. How many sinus are involved, especially maxillary sinus, ethmoid sinus, frontal sinus, sphenoid sinus. This is very important to know the disease extent. Second one, any associated fungal etiology is there or not. On CT scan we know these polyps associated with fungal etiology or not. This is very important. If there is a fungal etiology, fungal infection suspicion, we have to do surgery immediately. Otherwise this fungus goes into the eye, cause eye blindness and goes into the brain also. So don't neglect it. If you have the nasal polyps problem, get immediately CT scan of the paranasal sinus. Second one is we do the allergic skin prick test. Allergic skin prick test will help to know the how many allergens are causing this problem and the intensity of the allergens. Because if the patient has an allergy problem, you have to give immunotherapy after surgery. Immunotherapy is very important after surgery to prevent the recurrence of the disease. So some patients have myth that if you remove the nasal polyps it will come back, but it is not the 100%. If you treat your disease well, most of the times these polyps will not recur. Some patients will get the surgery and they will forget, they think they got cured. It is not the thing. After surgery also patient need to follow with the doctor. Mainly after surgery, Jalaneti or Neti wash is very important. If you do Jalaneti and Neti wash after surgery, most of the times these polyps will not recur. So existing disease we have to cure by surgery. After that we do the Jalaneti, then this disease will not recur, and if you have allergy we give the immunotherapy also. So surgery, allergy, immunotherapy and Neti wash will help to cure the disease completely. If you have this nasal polyps problem, contact Asian ENT Care Center in Hyderabad. They will diagnose the problem exactly and they do surgery and immunotherapy and they will cure your problems. For further updates, subscribe Socialpost Health channel YouTube.